drooping lily sign on IVP can be seen in. So the only point that you have to pay attention is it is not hydrated cyst. In a hydrated cyst, what we see is water lily sign, which is seen on a chest X-ray, whereas a drooping lily sign is seen in a duplicated system. Drooping lily is seen in duplicated system. D for drooping, D for duplicated system. Polycystic kidney disease shows spider leg appearance, whereas horseshoe kidney shows joining hand sign. It shows joining hand sign. Okay, so just remember that drooping lily is duplicated system. Next question: gold standard diagnostic procedure for uterine anomaly. Now please see, it's a uterine anomaly. Now I'm sure that a lot of you have marked the answer as laparoscopy, which is a wrong answer. Please remember, the answer actually should have been laparohysteroscopy, because laparoscopy will tell you the outer contour of normality, like this, arcuate uterus, like uterus biconvate, whereas septate uterus will not be assessed on laparoscopy. For that you need hysteroscopy. So if laparohysteroscopy is given in the choice, that is the best answer. If laparohysteroscopy is not given, then the answer is MRI. Answer is MRI. So that was the catch. Answer of an MCQ is dependent on the choices, the way that has been framed. So please be careful with that. Half-life of iodine 131 is. So again, it's a factual question. Answer is 8 days. 8 days. Iodine 123 has a half-life of 13 hours, whereas iodine 125 has a half-life of 60 days. Iodine 123, 13 hours, 131, 8 days, and 125, 60 days. Okay, so please be careful with this. Next question. Which of the following is a cause of unilateral hypertranslucent lung on a chest X-ray? So unilateral hypertranslucent, you want to see more blackness. What is the reason of getting more blackness? Either increase air or decrease soft tissue. So we're going to look at the choice, either increase air or decrease soft tissue. What is Poland syndrome? Poland syndrome is absent pectoralis major muscle. So absent pectoralis major muscle is decreased soft tissue, can be the answer. Asthma is hyperinflation but not unilateral, it will be bilateral. And bronchitis will lead to generalized dirty lung, and pleural effusion is a cause of opacity. So the answer is Poland syndrome. Most accurate investigation for assessing ventricular function. Please remember, the answer is MRI. If you have thought the answer is echocardiography, please remember, echocardiography is the most practical technique, but it's an eyeballing. It's a subjective test. It's a subjective test and it is not accurate at all. It's not accurate at all. Nuclear scan, which is a MUCA scan, is accurate, but the accuracy of MRI is better than the MUCA scan. So please, most accurate test is MRI. Now what do you do is a cine MRI, that you capture the beating heart, and in the processing software it will give you the ventricular function as well as ejection fraction.